Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Question 1. A client's arterial blood gas, ABG, results are pH, 7.30. PaCO2, 50 mm of mercury. HCO3, 24 milliequivalent/L. Which acid-base imbalance does the nurse identify? A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis. Correct answer, A. Respiratory acidosis. Rationale: the low pH indicates acidosis, and the elevated PaCO2 identifies the respiratory system as the cause. Question 2. A client's ABG results are pH, 7.49. PaCO2, 30 mm of mercury. HCO3, 24 milliequivalent/L. Which condition does the nurse recognize? A. Metabolic alkalosis. B. Respiratory alkalosis. C. Respiratory acidosis. D. Metabolic acidosis. Correct answer, B. Respiratory alkalosis. Rationale: a high pH with a low PaCO2 indicates respiratory alkalosis. Question 3. A client has been experiencing severe vomiting for 2 days. Which acid-base imbalance is most likely? A. Metabolic alkalosis. B. Metabolic acidosis. C. Respiratory acidosis. D. Respiratory alkalosis. Correct answer, A. Metabolic alkalosis. Rationale: vomiting causes loss of gastric acid, leading to metabolic alkalosis. Question 4. A client with diabetic ketoacidosis, DKA, is most likely to develop which acid-base imbalance? A. Metabolic acidosis. B. Respiratory alkalosis. C. Metabolic alkalosis. D. Respiratory acidosis. Correct answer, A. Metabolic acidosis. Rationale: DKA results in excess acid production, causing metabolic acidosis. Question 5. Which client is at the greatest risk for respiratory acidosis? A. A client with chronic obstructive pulmonary disease, COPD. B. A client with anxiety. C. A client with hyperventilation. D. A client with fever. Correct answer, A. A client with chronic obstructive pulmonary disease, COPD. Rationale: COPD causes carbon dioxide retention, leading to respiratory acidosis. Question 6, SADA. Which conditions can cause metabolic acidosis? Select all that apply. A. Diabetic ketoacidosis. B. Severe diarrhea. C. Renal failure. D. Lactic acidosis. E. Persistent vomiting. Correct answers, A, B, C, D. Rationale: DKA, diarrhea, loss of bicarbonate, renal failure, and lactic acidosis can all cause metabolic acidosis. Persistent vomiting usually causes metabolic alkalosis. Question 7. A client is hyperventilating during a panic attack. Which acid-base imbalance is expected? A. Respiratory alkalosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Metabolic acidosis. Correct answer, A. Respiratory alkalosis. Rationale: hyperventilation causes excessive loss of carbon dioxide, resulting in respiratory alkalosis. Question 8. Which assessment finding is commonly associated with metabolic acidosis? A. Kussmaul respirations. B. Bradycardia. C. Constipation. D. Slow, shallow breathing. Correct answer, A. Kussmaul respirations. Rationale: deep, rapid, Kussmaul respirations help eliminate carbon dioxide to compensate for metabolic acidosis. Question 9. A nurse reviews the following ABG results. pH, 7.52. PaCO2, 45 mm of mercury. HCO3, 34 milliequivalent/L. Which acid-base imbalance is present? A. Metabolic alkalosis. B. Respiratory alkalosis. C. Respiratory acidosis. D. Metabolic acidosis. Correct answer, A. Metabolic alkalosis. Rationale: the elevated pH and elevated bicarbonate indicate metabolic alkalosis. Question 10, SATA. The nurse is teaching a student how to interpret ABGs. Which statements are correct? Select all that apply. A. A pH below 7.35 indicates acidosis. B. A pH above 7.45 indicates alkalosis. C. PaCO2 reflects respiratory function. D. HCO3 reflects metabolic function. E. Normal blood pH is 7.00 to 7.20. Correct answers, A, B, C, D. Rationale: normal blood pH is 7.35 to 7.45. PaCO2 represents the respiratory component, while HCO3 represents the metabolic component of acid-base balance. Question 11. A client's ABG results are: pH, 7.28. PaCO2, 38 mm of mercury. HCO3, 18 milliequivalent/L. Which acid-base imbalance does the nurse identify? A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis. Correct answer, A. Naloxone. Rationale: naloxone reverses opioid overdose, improving ventilation and reducing carbon dioxide retention. Question 12. Which client is at greatest risk for metabolic alkalosis? A. A client with prolonged nasogastric suction. B. A client with diabetic ketoacidosis. C. A client with severe diarrhea. D. A client with renal failure. Correct answer, A. A client with prolonged nasogastric suction. Rationale: gastric suction removes hydrochloric acid, resulting in metabolic alkalosis. Question 13. A client has respiratory acidosis. Which assessment finding is most likely? A. Slow, shallow respirations. B. Hyperventilation. C. Tingling around the mouth. D. Increased neuromuscular excitability. Correct answer, A. Slow, shallow respirations. Rationale: hypoventilation causes carbon dioxide retention, leading to respiratory acidosis. Question 14. A client is experiencing respiratory alkalosis due to anxiety. What is the priority nursing intervention? A. Encourage slow, controlled breathing. B. Administer sodium bicarbonate. C. Encourage vigorous exercise. D. Restrict fluids. Correct answer, A. Encourage slow, controlled breathing. Rationale: slowing the breathing rate helps retain carbon dioxide and correct respiratory alkalosis. Question 15, SATA. Which conditions may cause respiratory acidosis? Select all that apply. A. Chronic obstructive pulmonary disease, COPD. B. Opioid overdose. C. Severe asthma attack. D. Pneumonia. E. Panic attack. Correct answers, A, B, C, D. Rationale: conditions that reduce ventilation cause carbon dioxide retention. Panic attacks typically cause respiratory alkalosis. Question 16. A client's ABG results are: pH, 7.47. PaCO2, 48 mm of mercury. HCO3, 34 milliequivalent/L. Which acid-base imbalance is present? A. Metabolic alkalosis. B. Respiratory acidosis. C. Respiratory alkalosis. D. Metabolic acidosis. Correct answer, A. Metabolic alkalosis. Rationale: the elevated pH and elevated bicarbonate indicate metabolic alkalosis. Question 17. Which compensatory response is expected in metabolic acidosis? A. Deep, rapid respirations. B. Slow, shallow respirations. C. Decreased heart rate. D. Decreased urine output. Correct answer, A. Deep, rapid respirations. Rationale: the lungs compensate by eliminating excess carbon dioxide through deep, rapid breathing, Kussmaul respirations. Question 18. A nurse reviews the ABG results of a client with severe diarrhea. pH, 7.31. PaCO2, 37 mm of mercury. HCO3, 19 milliequivalent/L. Which interpretation is correct? A. Metabolic acidosis. B. Respiratory alkalosis. C. Respiratory acidosis. D. Metabolic alkalosis. Correct answer, A. Metabolic acidosis. Rationale: severe diarrhea causes loss of bicarbonate, resulting in metabolic acidosis. Question 19. Which laboratory value is most important to monitor in a client with metabolic acidosis? A. Serum potassium. B. Hemoglobin. C. Platelet count. D. Cholesterol. Correct answer, A. Serum potassium. Rationale: metabolic acidosis often causes potassium to shift out of cells, increasing the risk of hyperkalemia. Question 20, SATA. A nurse is teaching a student nurse about normal ABG values. Which values are considered normal? Select all that apply. A. pH, 7.35 to 7.45. B. PaCO2, 35 to 45 mm of mercury. C. HCO3, 22 to 26 milliequivalent/L. D. PaO2, 80 to 100 mm of mercury. E. Oxygen saturation, SO2 95 to 100%. Correct answers, A, B, C, D, E. Rationale: these are the normal reference ranges used when interpreting arterial blood gases and assessing oxygenation. Question 21. A client's ABG results are: pH, 7.51. PaCO2, 29 mm of mercury. HCO3, 24 milliequivalent/L. Which acid-base imbalance does the nurse identify? A. Respiratory alkalosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Metabolic acidosis. Correct answer, A. Respiratory alkalosis. Rationale: a high pH with a low PaCO2 indicates respiratory alkalose. Question 22. A client with metabolic acidosis is breathing rapidly and deeply. This breathing pattern is known as A. Kussmaul respirations. B. Cheyne-Stokes respirations. C. Biot respirations. D. Apneustic. Correct answer, A. Kussmaul respirations. Rationale: Kussmaul respirations are the body's compensatory response to metabolic acidosis by eliminating excess carbon. Question 23. Which medication is commonly administered to reverse opioid-induced respiratory acidosis? A. Naloxone. B. Atropine. C. Epinephrine. D. Furosemide. Correct answer, A. Naloxone. Rationale: naloxone reverses opioid overdose, improving ventilation and reducing carbon dioxide retention. Question 24. Which client is most likely to develop respiratory alkalosis? A. A client experiencing a panic attack. B. A client with COPD. C. A client with severe pneumonia. D. A client with respiratory depression. Correct answer, A. A client experiencing a panic attack. Rationale: hyperventilation during a panic attack causes excessive loss of carbon dioxide, resulting in respiratory alkalosis. Question 25, SATA. The nurse is assessing a client with respiratory alkalosis. Which findings are expected? Select all that apply. A. Dizziness. B. Tingling of the fingers. C. Lightheadedness. D. Hyperventilation. E. Slow respirations. Correct answers, A, B, C, D. Rationale: respiratory alkalosis commonly presents with hyperventilation, dizziness, lightheadedness, and paresthesias. Question 26. Which acid-base imbalance is commonly associated with prolonged diarrhea? A. Metabolic acidosis. B. Respiratory acidosis. C. Respiratory alkalosis. D. Metabolic alkalosis. Correct answer, A. Metabolic acidosis. Rationale: diarrhea causes loss of bicarbonate from the gastrointestinal tract, leading to metabolic acidosis. Question 27. A nurse reviews the ABG results. pH, 7.33. PaCO2, 55 mm of mercury. HCO3, 30 milliequivalent/L. How should the nurse interpret these findings? A. Partially compensated respiratory acidosis. B. Uncompensated metabolic acidosis. C. Fully compensated respiratory alkalosis. D. Metabolic alkalosis. Correct answer, A. Partially compensated respiratory acidosis. Rationale: the low pH and elevated PaCO2 indicate respiratory acidosis, while the elevated bicarbonate shows that the kidneys have begun to compensate. Question 28. Which nursing intervention is appropriate for a client with metabolic alkalosis caused by prolonged vomiting? A. Replace fluids and electrolytes as prescribed. B. Encourage hyperventilation. C. Restrict potassium intake. D. Administer sodium bicarbonate. Correct answer, A. Replace fluids and electrolytes as prescribed. Rationale: treating the underlying cause and replacing lost fluids, chloride, and potassium helps correct metabolic alkalosis. Question 29. A client has the following ABG results. pH, 7.39. PaCO2, 50 mm of mercury. HCO3, 31 milliequivalent/L. Which interpretation is correct? A. Fully compensated respiratory acidosis. B. Uncompensated respiratory acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. Correct answer, A. Fully compensated respiratory acidosis. Rationale: the pH is within the normal range, while both PaCO2 and HCO3 are elevated, indicating complete renal compensation for respiratory acidosis. Question 30, SATA. A nurse is teaching a client ways to maintain normal acid-base balance. Which instructions should be included? Select all that apply. A. Manage chronic lung disease as prescribed. B. Stay adequately hydrated. C. Seek treatment for persistent vomiting or diarrhea. D. Take medications exactly as prescribed. E. Avoid smoking. Correct answers, A, B, C, D, E. Rationale: proper management of respiratory and metabolic conditions, maintaining hydration, medication adherence, and avoiding smoking all help maintain normal acid-base balance and reduce the risk of acid-base disorders. Comment your score out of 30 below. If this video helped you, don't forget to like, subscribe, and share it with a fellow nursing student. I'll see you in the next NCLEX practice session.